Thank you for joining the Minority Health Matters podcast, produced and paid for by the Indiana Minority Health Coalition. On our podcast, we will be providing information and discussions around pertinent health issues in our communities. So keep tuning in as we are your resource for all things minority health.
Hey, I'm Rayne.
And I'm Jacob. We're interns at the Indiana Minority Health Coalition.
And we're here with another segment on the Minority Health Matters podcast.
Thanks so much for coming to this podcast session with us, Emily. We're really glad to have you on. If you don't mind, we'll just jump right into it. Emily, could you describe who you are for our audience and what your organization does?
Sure. My name is Emily Weichert Bryant. I'm the Executive Director of Feeding Indiana's Hungry. We're the State Association of Feeding America affiliate food banks. There are 11 that collectively serve all 92 counties in the state of Indiana. And our members distribute food not only directly to clients in their area, but also through about 1,400 local agencies like pantries and kitchens and after-school programs. And so our state association supports them by convening, by running some programs for them, and then doing the bulk of the public education and advocacy.
That's great.
Can you describe what a food desert is for the audience?
Yeah, so a food desert, and there's different definitions from different agencies and different researchers. But generally speaking, a food desert is a place where there is both low access to food, whether that be, and typically the USDA is looking for grocery stores and big boxes, in addition to a low income area. So, if you live, where I live in town is a low access area, but it's not necessarily a low income area. So that wouldn't be described as a food desert. And typically they measure it differently between urban and rural areas. The notion being, if you live in a rural area, you just about have to have a car to get anywhere in this country and definitely in this state. And so they look at a larger distance. And then in a city, they would look at, they measure it as sort of a half mile or a mile or 2 miles. There's usually sort of an overlay, and you can click on how far you want that to go. But looking at a shorter distance, because the notion would be it might be more walkable. It's a more dense area. It's a more largely populated area.
Do you think the current definitions of food deserts actually reflect how they impact the residents of a food desert area? You mentioned how they often include distance in the definition of like distance from a grocery store or things like that. Do you think it would change people's access if that distance was half a mile or 2 miles? Like how dramatic do you think the definition, or how precise do you think the definition needs to be?
I think that really depends upon the person that it's impacting more than the research. But what I do think is not particularly reflective of the actual situation is that when they're looking, at least when the USDA is looking at whether there is access to food in those areas, they're looking for a large grocery store. They're looking for a big box. So they don't tend to count small convenience stores. They wouldn't count places like Cleo's Bodega, and they're definitely not including the charitable sector. A lot of places around town here in Indianapolis and in other towns and other cities, there would be, if you were a low income person who needed assistance, being able to access the grocery store may not be helpful enough for you. You may need the assistance from the charitable sector as well, and that's not accounted for. When I talk to legislators in rural areas too, I remind them that yes, your district very well may be a food desert, but I promise you that there's, multiple food pantries that are serving in that area as well. If you get to rural areas where there's, a stop sign or a stoplight or that flashing caution light that you get in a lot of rural areas. And I can say that because I grew up in one. If there's a church on the corner, if there's 2 churches on the corner, one of them's probably going to have a food pantry. So it's not about whether or not you can get to the next city to the grocery store for all people. It's a matter of what they can access near them. And the other thing I would say, there's not a lot of research, or at least there hasn't been a lot of research on food deserts as it pertains to at least SNAP recipients. It's one of the things that the USDA would kind of be able to track better. And there was one report that came out a number of years ago that indicated that for SNAP recipients, they were more likely to drive as far as or farther than non-SNAP recipients to shop, because the assumption is they want to make sure they're getting the best deal. And so, we're all creatures of habit, right? So we're going to keep going to that same grocery store, whether it's near to us or not near to us. If we know that's where we can get the best value, we can, get the most food for our families to be able to nurture them. And so it's a helpful measure when you're looking at access and development, but it doesn't really mean much to that individual household, unless they can't get further than that half a mile, or they don't have access to a car, those sort of things.
Yeah, that's a really great explanation. Could you describe if there's anything being done for recipients of SNAP benefits in food deserts, or how those people can do SNAP benefits actually really help those people if they can't get to grocery stores?
So there's a number of ways that SNAP has evolved, really, particularly during and since the pandemic, that we hope are able to make a positive impact on SNAP recipients who, may not be as mobile and may not have access to as much transportation as they should have. Um, in Indiana, there's currently a number of retailers that you can order online, and a lot of folks, would order online for, call ahead ordering, that sort of thing. But you can also have groceries delivered. The delivery fee is not able to be paid for with SNAP benefits. But if you live in Indianapolis, or if you live in the city, odds are pretty good. If you can afford the delivery fee, Amazon will deliver to your door, and so will several others. So the groups that are involved in that, Walmart, Amazon, Aldi with Instacart, and then I haven't looked to see if it's fully online, but Kroger, if it's not, is coming soon. And so you'd be able to get some of those things delivered, which helps a lot more in an urban area than it does in a rural area. SNAP doesn't really overlay, at least that I have seen, the folks getting benefits in a certain area with where is a food desert. Because again, just because they live in that place and they're receiving SNAP benefits, it doesn't mean they're shopping right in that neighborhood too. So it's hard to tell. I will say SNAP benefits, as they are, sort of created and as they're administered, there's really only a difference in benefit levels for places outside the 48 contiguous states. So, if the cost of food is more expensive in one place rather than another, the cost of living, the benefits don't account for that. Neither does the poverty level. Whether someone should be eligible for a program or not. If the cost of living in, let's say, California, that's a pretty easy one. Cost of living is going to be higher in California, but they use the same guidelines for what is poverty rather than what would be self-sufficiency, to be able to kind of determine things like whether folks are eligible for benefits. So we know that self-sufficiency generally is around 200% of the federal poverty level, and SNAP is about 130. So we know that there are people in a gap who's, could potentially get reduced lunch for their kids, would be eligible for the commodity food that our members distribute in the charitable sector. But other than that, they're not eligible for other benefits. And so there's a lot of folks that we catch up who aren't getting SNAP benefits but need the help, particularly right now. And so, the benefits, I think it's a very long-winded way of saying the benefits really don't adjust for individual circumstances, regional differences, or issues like whether they have the transportation to get to the grocery store in the first place. That's just, it's not how SNAP is set up, and it's not part of the calculation.
Mm. Yeah, interesting that you mentioned transportation just now. One plan I've heard of that has been launched in several cities is for the rideshare company Lyft to
Mhm.
provide like cheap rides to people who qualify based on economic calculations, to give them cheap rides to grocery stores so they can get their groceries. Have you heard of this plan? And do you think that's really a good way to address this problem, or do you think it's kind of just putting a band-aid over the problem?
I have heard of it. It's going on in multiple places around the country. I think this is sort of a nationwide offer from Lyft to try to help folks be able to do that. I think for many people, it would do the trick, because if all they really need is a ride from time to time, that might be all right. It's certainly not solving the problem of access to transportation. So it is more of a Band-Aid, but we know a lot of our clients are really working and going week to week. And if that week they need to ride to the grocery store and there's not a friend or a family member who could take them, that may be that extra little push that helps them get by. So it's definitely a good thing. But something else we've seen similar to that is that there are transportation companies who are providing delivery of food, and are doing so from food banks and pantries. Gleaners has a program that they're piloting that's doing a little bit of that for folks who aren't able to get out. It seems like it's the wave of the future. If you look at how the rest of society and the rest of commerce is functioning, whether it's talking about delivery, whether we're talking about drones somewhere in the future, these are all things that the food bank network is thinking about too, because we're able to access the same technologies if it's affordable to get product to clients, to get help to clients as we can. And so I think as we go further, I think there will be more and more opportunities for things like that with partnerships, or just with affordable services to be able to move food to people where they are, rather than requiring them to come to us.
Are these programs free of cost, or do we have to still pay?
For the Lyft, I think there's grant funding behind it, so I think it's covered by the grant funding with the Lyft program. I'm not 100% certain on that because it doesn't come through one of our members, so I haven't looked that carefully. I think it varies. If we're talking about the cost of delivery or things like that coming from a private company like an Amazon, that's certainly something that folks would have to pay for. If it's coming from the charitable sector, that is not. That's not a business model that anyone has that I know of. I think it's finding good community partners to provide that, because we don't want to make our clients. We don't want to create any hardship for our clients. We just want to make sure that the product gets there as easily as possible, and there's certainly no charge that that our members access or assess on clients for the purposes of help.
I think I want to clarify my question a little bit more. Not the Amazon and Lyft services, the services that are bringing the food from the pantries, because that food is already free. So the delivery, how does that work?
Yeah, it's grant funded and or privately funded, right? So the
Okay.
program that Gleaners has, the pilot that they have, there's no charge to the client for that.
Okay. Thank you.
Sure.
And do you think that food deserts are particularly found in minority populations, or does it really matter?
So in emailing back and forth, I don't have the good geography to tell you that. That's not my area of expertise. I think certainly it matters
Right.
from the point of food justice. And I think assumptions could be made that, that is a connection. But it certainly matters when we're talking about, access to the necessities, and who's being impacted more frequently than others. So that's definitely something that is important.
Yeah.
Thank you. Can you explain how food deserts are started in the first place?
You know, this is where I may rely on my history degree a little bit. Um, Comes in handy from time to time. Years and years ago, it was more about communities. It was, people were living more closely together and interacting more closely. So I know in the small town where I grew up, there was a tiny little grocery store, that was, who served pretty much anyone. And as the years passed and, transportation became different, we saw the advent of, big box stores rather than the neighborhood grocery store that was more the norm. I think that was more and more when, that aided the creation in food deserts, because that neighborhood store maybe wasn't profitable, or that neighborhood store wasn't going to make any money if there was a big box store somewhere else that people were going to. And so I think that was really how that began. I think when we look at food deserts, it's a little bit more of whether, that retailer feels that it is profitable. The grocery industry is very marginally profitable. If you have a large chain of stores, if you have one store that's a loss leader, you can have other stores that make up for that. And so if you've got a bigger company to spread the risk, I think it's easier. Whereas if you've got one store in a neighborhood and you're not making enough to stay open, you're not going to stay open. I think that's made a difference throughout history, the last several decades. And so I think that's probably how we landed in this space. And then, throwing in inequities, um, racism, biases that probably exacerbated those issues is probably how we found ourselves where we are today.
Thank you. I wonder if this problem is specific to the United States. I know in some other countries, especially Europe, it's much more like local grocery store that you shop at for your groceries that you cook that same day. I think that'd be an interesting thing to research a little more.
Absolutely.
Grocery stores are like closing down more frequently nowadays. Do you know why that is, or?
Oh gosh. I lead most conversations with I'm not an economist, so I don't have a good answer to that. I'm sure it's when they become unprofitable, but I don't know enough about circumstances surrounding that to know why they're not profitable.
And another question I had was about the local urban agricultural gardens. Do you think that they're helping the problem, or are they at a standstill?
So I work in sort of macro perspective hunger relief, right? So our members distributed 113 million pounds of food statewide last year. We distribute all the variety. The average within the network is around 70% what we distribute are foods to encourage. There is no definition state or federally of what is nutritious, but we know what that is. It's grains, it's produce, it's protein, it's dairy, right? So the food that our members distribute fits those categories, is more often perishable, and is often fresh. That said, we are working most frequently with conventional agriculture to meet the needs we have for quantity. So I think the community gardening aspect and the urban gardens and things like that are I think they are growing. I think it's become more common. Absolutely serve a purpose and a need in that community to be able to provide, for a lot of places it's how to garden. Certainly something I could definitely use some help with because not everybody has a green thumb. The ability to access, some produce and things in your neighborhood and create a sense of community. Those things are all very positive. And, if it's a food desert, maybe being able to access some produce right in your neighborhood there can be helpful. It's not an answer to hunger or to food insecurity because of at least not a broad answer, because we live in Indiana, we have a short growing season. There are things you can do to extend that, but it's pretty expensive. And quite frankly, it's not going to produce enough product to be able to feed, anyone who needs help in that particular neighborhood. So it's not a solution to hunger per se, but it's absolutely a solution for that neighborhood to be able to provide better access, better produce, better other things that come from that particular movement and that particular aspect.
All right, I understand a little bit better now.
Thank you.
And just to wrap it up this segment, what do you think could be done in the future to address the issue of food deserts around Indiana?
So there's been legislation that we've seen both state and federally. Representative Robin Shackelford had a bill, this General Assembly, that hasn't moved but started a good conversation. Congressman Carson has had legislation in the past, I think will again, that looks to provide solutions for food deserts. A lot of those ideas stem from finding ways to incentivize grocery stores or some version thereof to move into a food desert and to stay there and become part of that community. And I think that's definitely one piece of the puzzle. It's sometimes easier said than done because, most for-profit entities are working on a balance sheet where they have to stay in the black. And if it's not there for them in that community, they're not going to make that investment. I think in a lot of ways it's a good tool to have in the toolbox. But really, what's going to solve issues of food deserts and what's going to solve issues of food insecurity really stems back to how well people are being paid and whether they're able to have the income that they need to provide what they need for their families. So, you can live in a food desert, but if you've got access, if you've got transportation, if your family has enough income that putting gas in the tank isn't a hardship, then where you live or your zip code is not so important. Really, the root causes of hunger are poverty related. We definitely see things being impacted when unemployment kicks in. That I think moves the needle more quickly on food insecurity. Unemployment does, but really at the baseline, it's poverty. And so, how do we find ways to bring people out of poverty? I think that solves more problems than just working to fix the food deserts. So I don't have a good answer for that. There's no silver bullet. There's no single thing that can be done. It's just a much broader approach to hunger when we look at, how do we alleviate the root causes? So, our members talk about how do we feed the line and shorten the line. And a lot of that goes toward workforce training, goes towards the Good Wage Initiative here in town, goes towards making sure folks have the services that they need and the supports they need to be able to work or to have childcare or skill up or whatever it is that's needed in that particular family, to the point where whether there's a grocery store within a mile of your house or not is irrelevant.
Thank you. That was a great answer. Well, Emily, those are questions for today. Thank you so much for joining us. We
Thank
really appreciate your
you.
expertise on this issue, weighing in and teaching us all a little bit more about how food deserts happen and
Giving
what
us
we can
some
do about
insight.
them.
We appreciate it so much.
Thank you for having me. I appreciate it.
Of course. Hopefully, we'll get to talk again sometime. Thank you.
Sounds great. Thank you.
Bye.
Bye.